and welcome. We would first like to thank you for agreeing to be part of this unique initiative which seeks to address the concerns in people's minds with regards to COVID-19 vaccination and living in the new normal. India is just about recovering from the COVID pandemic and is restarting again. This period of COVID infections has been tough and the challenges haven't quite gone away as yet. The risk of COVID infections continue as we unlock and start to resume our lives. Today we have with us experts to share with you advice on how to continue living long and healthy with COVID vaccinations. Today we have with us Dr. Tejas Kamat. He is a director and consultant at Diabetes Care in Goa. My question first to Dr. Tejas Kamat, is it essential to get vaccination? Should we wait for better vaccines to come along?
Absolutely essential for those who are right now eligible to take the shot to go out and take the vaccine as early as possible. Remember, both vaccines which are available with us in India today, the Covishield and Covaxin, they have shown almost 100% efficacy in preventing deaths out of COVID-19. They have been highly effective, so almost efficacy is around 90 to 100% in preventing serious infections out of COVID-19. And they have moderate efficacy between 80 to 90% in preventing moderate COVID infection. So I don't think there is any need to wait for better vaccines. We should go out and take the shot as early as possible.
Right. Dr. Tejas Kamat, can people with type 1 diabetes take vaccination? Is it safe, or does a person need to check blood glucose levels before getting themselves vaccinated? Also, should one stop taking insulin on the day of getting themselves vaccinated?
Patients with type 1 diabetes can definitely take the vaccine shot. While it will be prudent to have a good glycemic control so as to prevent long-term complications which are associated with diabetes, for taking the COVID vaccine, either Covishield or Covaxin, you may not check your blood sugars. You may just go out simply without doing a blood test and get the COVID vaccine shot. Because even if the sugars are high, it's not known to increase the risk of vaccine-related side effects. As far as your other question was concerned, with regards to patients with type 1 or even type 2 diabetes, there is no recommendation to stop either insulin or any of the oral anti-diabetic patients that one patient might be on the day or while taking the vaccine shot. It has to be continued.
Dr. Tejas Kamat, what are the common side effects of the vaccine? Are the side effects common to both?
Yes, so largely the side effects of both Covishield and Covaxin are almost the same. So if you have taken the shot, most likely you are likely to experience a local injection site reaction. So there may be redness, swelling, itching, or kind of a burning sensation at a local injection site. You may get mild fever, body ache, muscle and joint pains. You may experience slight headache or dizziness on the day of vaccine or the next day. There are other less common side effects like nausea, loss of appetite, gastric intolerance, which have been reported. But what I'm very happy to say here is, as we are talking today, more than 3.5 crore of our Indian population has been vaccinated, have received at least one shot. And I'm very happy to say that no serious side effects have been reported from any part of the country.
Right. Dr. Tejas Kamat, post-vaccination, are you fully safe from the risk of COVID-19, or are there still chances that one might contract the virus?
Is the vaccine 100% effective? So we have to understand two important points here. First, the neutralizing antibody, the sufficient immune response, develops only 2 or 3 weeks after the second dose. So if somebody has just taken the first dose or taken the second dose only a few days back, he may have not yet developed a sufficient immune response and still may be at risk. And second important point to note is that prevent us from getting symptomatic COVID. So the risk of mild, moderate or severe COVID infection or deaths will be reduced. They may not be effective in preventing the virus from entering our body. So we may still end up getting the virus and maybe an asymptomatic carrier and maybe transmitting the virus to others. And that is precisely the reason why still continuing with the COVID appropriate behaviors, masking, social distancing and hand hygiene remains very much essential till the time we are able to vaccinate many.
Right, thank you so much, doctors, for joining us on our special show. And as we end the show, a quick reminder to our viewers to go and get a vaccine as and when they're eligible. Thank you so much for your time.